Joining us now is Walter and Dr. Gupta, and we're talking about essential dental. Welcome to the show to the two of you. How are you?
Good.
Good.
Thank you for
Thank you
having
for having us,
us.
Donna.
Good. Dr. Gupta, why Walter? Why did you hire him as your office manager?
Oh, well, Walter's basically the heart of our practice.
Okay.
When people come to our practice after me, they're like, Walter's still here, right? Because we only want to work with Walter. He takes care of the patients from the moment they come into the door. He is courteous with them, friendly with them, and he goes the extra mile to make sure that they feel comfortable, whether it's with their insurances, whether it's with their treatment plans, and whether if they just want to have a few more complaints and they're afraid to talk to the doctor about it. He's there
Understood.
for them.
Okay, so you help people get relaxed before they ever get to the dental chair.
Yes, so I help with the check-in process. Not everyone likes to go to the dentist. So we try to make it as easy as possible for them in an environment where they feel safe and comfortable. And then, yes, after Dr. Gupta gives them the treatment plans, I usually go and, talk to them about what the next steps are and, try my best to get the maximum benefits from their insurance and just get them situated with all the work they need.
Because once they get in the door, you just don't want them to like bolt out, right?
Exactly.
Like they
Yeah.
get there and then all of a sudden like that deer in the headlight, like fear comes over them sometimes. I don't know why that is. I don't know why people are so afraid to go to the dentist.
Well, I think a lot of it has to do with the environment. I find that when patients come in, they are afraid they're only going to get 5 minutes with the dentist or 5 minutes with their doctor. And a lot of times they get a lot more times with the nurses, the PAs, the front desk staff. And yes, that's what Walter is there for. But once they get in the room, I don't stand over them. I sit with them face to face like you and I are.
Okay.
And I just, no gloves, no nothing. I just sit and talk to them. And I listen to them before I look at their x-rays, before I start shoving my hands in their mouth. I want to talk to them and find out. Before I even go in the room, Walter's already told me this patient's a little anxious.
Okay.
They're a little worried about this. They're embarrassed to say they haven't been to a dentist in 5 years. So, he gives me a little blurb about them so I know what to do. And once I get in there, they are my only focus.
Beautiful.
My head is not somewhere else. I'm not running to another room. I'm not
One
answering
mouth
any
at a
calls.
time.
One person at a time.
Got
It's
it.
all about the patient.
Okay. One of the reasons that I wanted to have you here today is to celebrate the fact that you use technology in a new way to help the patients have a better experience, right? Better dental outcomes. Tell us about the old way compared to what you're doing now, Dr. Gupta.
I love this question because when I first started the practice, I took it over for someone who was still using the film. You guys remember the film, the sharp edge things that go in your mouth? And
Oh,
then it
yeah,
takes
those were painful.
20 minutes for them to dip it in a tank. And then after 30 minutes when the films come out, sorry, half of them are bad or they got exposed to light. Well, we don't have that anymore. We have digital x-rays. But that's even old-fashioned now. Digital x-rays, where they take the x-ray and it shows up on the computer the right way, great, that's fantastic. We have an image for you which shows a periapical image. But if I may.
Sure, of course.
If you look at this tooth, a tooth is not just the front. It's a three-dimensional object.
Okay.
So why are we taking a two-dimensional picture of a three-dimensional object?
Oh, good point.
That's only giving us part of the story.
Okay.
So what we need to do is be able to take the picture of the tooth in every dimension. So now what we need is a cone beam CAT scan, which is what we have in our office.
Okay.
And they were usually used by surgeons for doing implants, sinus lifts, a lot of different specialty procedures, but now they're being used for everything from endodontics to implant dentistry and for diagnostic purposes. So now we don't miss anything. We can see
Beautiful.
everything in the patient's mouth and properly diagnose. You can't treat a patient if you can't diagnose a patient.
Now, mercury poisoning, okay? You're probably dealing with some people in the population that have the old mercury fillings. When they come to you, are you helping them like restore their smile by like maybe lifting those out, or sometimes they're not working for their mouth anymore? Is that a frequent problem that you're helping people with?
Well, I'll tell you, we don't remove silver fillings or
Okay.
mercury fillings if the tooth has no problem in it. Because
Okay.
by removing it, sometimes you create a problem. You can irritate the nerve and create a pulpitis, which could turn into a root canal. But if they come with a cracked mercury filling or silver filling, we do not put another one in. We put in
Got
a
it.
white filling or a
Okay.
crown, and we even have a specialized amalgamator separator that removes all of those silver fillings so they don't get infiltrated into the environment. They are disposed of safely, and we don't deal with the companies to make sure that it doesn't go into the water supply or drinking water or anything like that. So silver fillings are gone, metal crowns are gone.
Okay.
Metal dentures are gone. We're a
Wow.
metal-free office. We don't know how the metal affects our body. And let's face it, who wants metal in their mouth? It hurts.
Yeah.
You
it
know,
does hurt.
those anybody who's had metal dentures and they feel it scraping up and down, and who's had metal braces and it cuts up their gums and their tongues and their lips, or even the metal crowns. How many people have had those crowns that my crown chipped? What's this black underneath? That's what's really on your tooth. The
Right.
metal base. They just have a thin layer of porcelain on top. No more. We do zirconia crowns.
Lovely.
Zirconia crowns are just one block of pure zirconia. They're stronger than your tooth. If you were in a car accident, you'll break your teeth before you break that crown. It'll last 20 to 30 years. It's fantastic. It's inert. It doesn't affect your body. It's a fantastic crown. And
Well,
we only do zirconia.
It's funny because in construction, sometimes they'll be like, it's a 30-year roof. So that's something else that you could like stand behind, right? It's like
Absolutely.
one and done. So if you're going to spend the time to come in, might as well get something that's going to last.
Right. They say the old porcelain fused to metal crowns have a 5-year life. If you get 10 years, that's good.
Right.
Zirconia, come in 20, 25 years. If the first year it fails, we replace it for free because that would be maybe a technological error or something. But I haven't replaced a zirconia crown yet since I've been using them.
Excellent. Did you get that little knock?
Yeah, I got the knock.
Thank you, Dr. Gupta, and thank you, Walter, for joining us. It sounds like you're creating a pleasant experience, and for happy, healthy mouths, right, for decades to come. Thank you very much for joining us, Essential Dental.
Thank you very much,
you,
Donna, for
Donna.
having us.
You're
It's
welcome.
been a pleasure.
There you go. I have a little bit of metal in my mouth, but just two little things. So stay tuned for more. We've been living it up right here with Essential Dental.